NCLEX RN Practice Test Free 2026 questions to test yourself anytime. Question 1. Which test result would confirm the diagnosis of hyperthyroidism? Option A. No increase in TSH during a TSH stimulation test. Option B. A decreased TSH level. Option C. An increase in TSH after 30 minutes. Option D. Below normal levels of serum T3 and T4. The correct answer is option B. A decreased TSH level. In primary hyperthyroidism, high levels of circulating T3 and T4 suppress the pituitary gland, resulting in a low TSH level. Question 2. When teaching a client how to rotate insulin injection sites, which instruction is correct? Option A. Inject insulin into healthy tissue with large blood vessels. Option B. Rotate injection sites within the same anatomic region. Option C. Administer insulin into scar tissue or hypertrophy. Option D. Administer insulin into sites above muscles you plan to exercise. The correct answer is option B. Rotate injection sites within the same anatomic region. Rotating within the same anatomic region, exampled different spots on the abdomen, helps maintain consistent insulin absorption rates. Question 3. Nurse Sarah expects an elevated serum glucose in HHNS. Which other laboratory finding should the nurse anticipate? Option A. Elevated serum acetone level. Option B. Serum ketone bodies. Option C. Serum alkalosis. Option D. Below normal serum potassium level. The correct answer is option D. Below normal serum potassium level. HHNS involves profound osmotic diuresis leading to total body potassium depletion through urinary loss. Question 4. For a client with Graves' disease, which nursing intervention promotes comfort? Option A. Restricting intake of oral fluids. Option B. Placing extra blankets on the client's bed. Option C. Limiting intake of high carbohydrate foods. Option D. Maintaining room temperature in the low normal range. The correct answer is option D. Maintaining room temperature in the low normal range. Hyperthyroidism causes heat intolerance due to a hypermetabolic state. Keeping the room cool directly promotes patient comfort. Question 5. Patrick is treated in the emergency department for a Culls fracture. What is a Culls fracture? Option A. Fracture of the distal radius. Option B. Fracture of the olecranon. Option C. Fracture of the humerus. Option D. A fracture of the carpal scaphoid. The correct answer is option A. Fracture of the distal radius. A Culls fracture is a common fracture of the distal radius at the wrist, usually caused by falling on an outstretched hand. Question 6. Cleo is diagnosed with osteoporosis. Which electrolytes are involved in the development of this disorder? Option A. Calcium and sodium. Option B. Calcium and phosphorus. Option C. Phosphorus and potassium. Option D. Potassium and sodium. The correct answer is option B. Calcium and phosphorus. Osteoporosis involves the loss of bone density, which is primarily regulated by the balance of calcium and phosphorus. Question 7. A firefighter treated for smoke inhalation develops severe hypoxia 48 hours after the incident. What condition has likely developed? Option A. Adult respiratory distress syndrome, ARDS. Option B. Atelectasis. Option C. Bronchitis. Option D. Pneumonia. The correct answer is option A. Adult respiratory distress syndrome, ARDS. ARDS is a common and severe complication that occurs 24 to 48 hours after a lung insult such as smoke inhalation or trauma. Question 8. A client develops acute shortness of breath and hypoxia following a right femur fracture. What is the most likely cause? Option A. Asthma attack. Option B. Atelectasis. Option C. Bronchitis. Option D. Fat embolism. The correct answer is option D. Fat embolism. Fat embolism syndrome is a critical risk following long bone fractures and typically presents with sudden respiratory distress and hypoxia.